Welcome to the bottom of the scrub bin. We are Lauren and Pam, nurses by training, pharma by accident, and moms by pure chaos. We've cleaned up the messes in hospitals, in drug safety, and in life, so now we're talking about them. Grab your coffee, your scrub top, or whatever's at the bottom of your own bin, because we're digging in. Hi everybody, and welcome to episode 2 of Bottom of the Scrub Bin. After launching our first episode, we were excited and humbled to see downloads coming in not just from around the US, but internationally as well. So to all our listeners around the world in healthcare, pharma, and beyond, thank you for being here with us. Now let's begin.
Have you ever sat in a waiting room thinking, why am I always on time, but the doctor is always behind? Today, we're breaking down what's actually happening behind the scenes, and we're also giving you tips to avoid waiting longer than you need to and how to know whether you should go to the doctor, urgent care, or the emergency room. So that brings us to our first segment, behind the scenes on why the doctor's office runs late. So let's start with scheduling. Every doctor's office or clinic usually will schedule sick visits for 10 to 15 minutes, 20 minutes for a physical, or 30 minutes for new patient. I know some people say, well, if the doctors are always behind, then why don't they just schedule them longer?
Right.
But then if you think about it, if you schedule a longer visit, so let's say a 20-minute sick visit, a 30-minute sick visit, you're reducing the amount of patients that can be seen that day, right? So would you rather just wait a little bit longer and be seen that day? Or would you rather sit there with your screaming child with an ear infection and have to go home that night?
Definitely that
Right,
day.
right. So I'd rather sit in that waiting room
Mhm.
and, get some medicine, get seen, whether it's me or my child, or be forced to go to an urgent care or an
Yeah,
emergency
or an
room that's going to
emergency
take
room.
even longer than that wait that you had in the doctor's office, right?
Exactly.
Mhm,
Yep.
mhm. So another reason is those orders that they have, that takes time in between patients. So for example, if room 1 has a flu and a strep test, room 2 has 4 vaccines that they need, and room 3 has 2 vaccines, you got to think about that nurse is having to juggle these 3 rooms, right? So the nurse is
Right.
taking that flu and strep test to the lab to start running that. While those tests are running in the lab, she's drawing up those vaccines for room 2. So while she's drawing up those vaccines for room 2, those results come in for that flu and strep test for room 1. So then that nurse takes those vaccines to room 2 and she's ready to give those vaccines. And now you have a non-compliant teenager. And now we're trying to coax this teenager, telling her it's going to be okay. And that can take anywhere from 5 to 20 minutes just to get this teenager or patient that's going to finally accept and get these vaccines. So
Yep.
once that happens, this person in room 3, yes, they've been waiting, but now we can finally go and get those vaccines drawn up and give those vaccines.
Yeah, so essentially it's the invisible work happening between the patients that nobody really sees, but everybody's working their tail off.
Another thing that's really big for me and it always sticks in my head, I'll never
Mhm.
forget it. And so every time I'm in a waiting room, I don't say anything. I just sit there and I wait because I don't know, it's like it traumatized me, but working in pediatrics, we had a young child come in. The mom brought the child and the child had a fever for a few days, low grade, nothing crazy, but was very tired, wasn't getting his energy back. And mom thought it was just a virus, but it went on for so long. She says, let me just have him seen. Okay. So
Right.
she brings him in, can't really find anything. And just to kind of rule out some things, the doctor orders a CBC.
Mhm.
And I took the blood to the lab, ran it through the machine. CBC comes back abnormal.
Yeah.
CBC for those, a complete blood count. And I flushed, I didn't like what I saw, so I flushed that CBC machine and then reran it. I ran it 3 times, and unfortunately, it kept coming back abnormal. So what we did when that happened is our doctor's office was attached to a hospital, so we sent them to the hospital lab,
Mhm.
and just to kind of confirm our CBC machine was correct. And so sure enough, it came back and suspect leukemia. And that doctor now has to go in and tell this mom, she was just thinking my child has a
The
virus, but now he has
virus.
to go in there and goes, he may have leukemia, but we need to
Mhm.
send him to oncology. So while he's going in and telling this mom who's
Who's
going to be
in shock,
devastated, who's
essentially.
in
Yeah.
shock, the nurse has to now go call and give the heads up to UNC Peds
Mm-hmm.
Oncology. And this mom in the room next door sticks her head out and is just going off. I've been in here for blah, 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 just going off. And
Yeah.
it was all I could do not to look at her and be like, if you had any idea what was going on next
Right.
door, you would just
Right.
sit there and be quiet. And the other thing is, it's not just that, those walls are thin. Those people can hear you. So this mom's
Mm-hmm.
who is getting devastating news is now also at the same time hearing this other mom
Yeah.
throwing a
Yeah.
fit, and she's lucky enough that her kid just has a virus or a cold or
Right.
an ear infection.
And as we get into later, it's okay to ask, but
Mhm.
it would be helpful if you could just be a little understanding to the
Right.
situation. And I
Mhm.
mean, that's essentially what we're doing in this episode, just kind of
Mhm.
informing you of what is going on behind the scenes and what
Right.
may attribute to those extended wait times, right?
Mhm. Right.
Um, and not only does this wait occur in doctors' offices, but it can happen in hospitals as well. So, one prime example is the ER emergency room. You walk in with a problem, you're checked in, and
Mhm.
you provide your insurance information to the front desk. You sit there for an hour or so before you see the triage nurse. And during this time, what you don't know is that your insurance is typically being verified.
Mhm.
If your triage and your symptoms aren't life threatening, you could be waiting a couple more hours before an ER bed or an ER doc become available. And then once you're back in the back of the ER, in a bed, the doctor sees you, but it takes even more time to get a diagnosis. And by this time, we're asking, why? Why is this taking so long? So there's a lot going on behind the scenes. And the same holds true for other things like imaging,
Mhm.
which include x rays or MRIs and even medications. So once a doctor gets your labs tests and your imaging results back, they have to put together a treatment plan for you. So
Mhm.
each of these little chaotic tasks take time, and that time adds up. And that is essentially what results in you waiting there for a couple
Right.
hours or so.
Right. In addition, just to add to all of that you just mentioned, if somebody comes in on EMS in the ER, they have to
Yes.
put everything with you on hold if you're
Hmm.
stable and go attend to this patient that just came in by ambulance. So,
Yeah, because it's a more emergent situation and they may be
mhm.
more critical
Right.
than you. I know I've been sent to the ER on a couple occasions, and my symptoms weren't that crazy. I know one Thanksgiving, I actually cut the top off of my finger cutting sweet potatoes. And I mean, it turned into a 6-hour visit just to get
Right.
stitches, in my thumb,
Mhm.
just because we did have a couple more critical patients come in via ambulance.
Right. And keep in mind, another thing is phone calls and messages. Doctors have to take urgent calls in between patients. So sometimes
Yes.
you've got pharmacies calling, going, hey, can I get a medication clarification?
Hmm.
Urgent findings for patients that were seen in the morning may come in the afternoon. Those doctors have
Right.
to call some of those patients or the parents and say, we have this finding on whatever, you need to go to the emergency room, whether it's a lab or an x-ray or anything like that. Yeah. And a lot of times you're calling into that nurse hotline that a lot of doctors' offices have,
Hmm.
and the nurse maybe can't answer your question and she feels it's an urgent question. So she'll go and grab that doctor in between visits, in
Right.
between patients, and say, hey, can you just help me with this?
Yeah.
Another thing doctors are doing in between patients is they're calling families with results. And sometimes it's not the doctor, it's the actual system, and it's not in the doctor's hands, it's not in the nurse's hands.
Hmm.
Right now, there's a nursing shortage, room
Hmm.
availability. So sometimes you'll sit in that emergency room, and it's kind of like you sit in the emergency room because you're waiting for a room on the floor. And if you're taking up that emergency room bed, then somebody's sitting in the waiting room until that
Right.
bed becomes available. So it's kind of like
Exactly.
a domino effect. They're waiting on insurance approvals.
That's a big one. That
Yes,
takes forever.
forever, which is
That's
ridiculous. That's a whole nother podcast in itself, or a whole nother
Yes, it
episode.
is. Yeah.
insurance, we're going to be talking about you.
Yes.
Yes. And computer issues. I mean,
Oh,
if they're not
mhm.
working, it creates a big weight, a big hold. And the biggest one I want to talk about, and I know we have a couple stories for this one, is the schedules are built like a domino chain, like I said earlier, meaning the appointments are scheduled one after the other. So if one appointment runs behind, all the others are going to be delayed.
Yep.
And so this happens because add-ons, a lot of times, and Lauren and I speak very specific to pediatrics a lot because that's kind of where our background is, but it really goes hand in hand with all doctors' offices, whether it's primary care, pediatrics, anything,
Mhm.
is the add-ons. And with pediatrics, parents bring in siblings and one sibling is diagnosed with strep. Well, now it's like, well, I've got the two siblings here. Can you just go ahead and see them? And
Right.
a lot of times they'll just go ahead and do that because, they're there, just go ahead and knock it out.
But again, there's that extra work that
And
they're
the
having to
extra.
work in, right? They have to verify the insurance for those siblings. They have to pull up their charts. They have to enter, they have to triage those children as well. So they're fitting 3 appointments into one, essentially.
Right.
So essentially, when your appointment runs late, it's often because someone before you needed more care, like you just touched on, Pam, than the schedule actually allowed. So now that we've pulled back the curtain on why offices run behind, let's talk about what you can actually do to make your visit a little smoother and even maybe a little shorter, right? So we're going to get into what patients can do to avoid being late and make the visit smoother. A couple tips and tricks that are actually useful. The first one being arrive early. It really helps if you arrive no later than 10 to 15 minutes early. That makes a big difference, bigger than you actually would think. This is especially true for new patient visits, annual physicals or sports physicals, pre visit paperwork that wasn't completed ahead of time. And just to note, but walking right in at your appointment time doesn't mean you're actually early. It actually means you're behind because your actual visit starts at your scheduled time. So, another tip, I personally would advise filling out all pre visit forms in advance if possible. Utilize the online check in and pre visit forms. They're your best friend. They can help expedite things once you do arrive to the office. And they can prevent data intake delays, they can prevent insurance issues, and medication reconciliation slowdowns. And touching on medications, I would advise always bringing in a list of your medications that you're currently taking, not just a list mentioning, oh, I take this little white pill once a day or once a week. I would include the name, the dose, how often you take it, because medication review is one of the most important safety steps in your visit
And that may
and
be a
useful.
result, Lauren, of,
Mhm.
and maybe you don't agree, but each doctor is on a different portal, right?
Yeah.
So it depends on which hospital they're affiliated with. There's so many different
Mhm.
portals. I know that for being one of my family members is they'll have a medication list that's old in one portal because they haven't been to that doctor in a while.
Right.
And then you have to update that. So I
Mhm.
kind of wish everybody was just on one portal and it all connected, but I
Yeah,
guess
there's that
we haven't
communication
got there yet,
breakdown. Yeah.
right?
Yeah.
We-
And, Pam, in that regard, that's where this can kind of help because
Mhm.
you would have the master list of all
Right,
the medications that you're on
right.
and can inform the doctors
Mhm.
of the medications you're currently taking.
Right.
Yeah. And then the next tip, I would say bring a short symptom timeline with you because, the moment we sit in front of a provider,
Mhm.
we forget the details. Everything just goes out out the window,
It does
right?
for me anyway.
Yeah, me too. It's like panic. Oh my gosh, what was I going to talk about?
Why am I here?
Yeah. And so it's important to, do a timeline of the symptoms you've been experiencing, when your symptoms started, what makes them better, what makes them worse, what have you tried to help alleviate these symptoms, and then definitely point out any red flags that you've been experiencing or that you think are somewhat abnormal and that you should be mentioning to your provider.
Mhm.
And then I'd say the last tip, which is the most important, is have your top 2 concerns ready to address with the provider. This ensures that your top priorities get addressed during the short visit span. So don't save the biggest issue for the last 60 seconds, like, oh, I also had chest pain for the last 3 months.
Those were
I
my
mean,
favorite. What?
yes, yes. That's a pretty big deal, and that's
Right.
going to take more than 10 minutes to address. So, right there, that is just going to derail your entire appointment. So, make sure you have those top two priority issues at the top of your list so
Hmm.
that your provider can address them right off the bat. And then, just something that I want to note to the listeners, if you're late, you may get rescheduled. And this is not personal, it's not a personal attack in any way, shape, or form.
Right. And keep in mind that most places have a 15-minute rule where if
Hmm.
you're 15 minutes or more late, they're going to ask you to reschedule. You won't be seen. But these offices they do understand that things happen, such as traffic. So if
Yeah.
you just call and let them know, like, hey, I'm on the way, but there's been this accident and traffic is bad, they may
Hmm.
be able to accommodate and possibly see another patient until you get there, and the
Hmm.
secretary may be able to go and tell the nurse or the doctor, "Hey, they called, they're on the way, they're just stuck in traffic," and we'll work around it. So just calling ahead shows them that you're being respectful of their time.
And I don't know about anybody else, but I live near a railroad
Mm,
track and it never fails. Like, I don't know the train schedule, but it never fails. Every time I'm trying to get to an appointment on time is when this train comes rolling in and I'm stuck
mhm.
at the crossing for a good 20 minutes while they load everybody up on the train and then it takes off again. So, in those
Yeah.
instances, I have called the doctor's office before saying, "Hey, I'm stuck behind this train. I am so super sorry. Just to let you know, I'm gonna be late, or do you think I should
Yeah.
reschedule?"
Laura, those
And
tracks aren't even active, but if you're going somewhere,
yes,
they are when you need to be somewhere.
exactly. Like, that's the only time the train comes by is
Right.
when I need to be somewhere. But 9 out of 10 times, they've been very accommodating and, they'll try to work me in now. I may be
Right.
waiting there a little longer, but, you know,
Right.
trains happen. And, just to point out, clinics can't keep moving forward if they hold every
Mhm.
slot for somebody who may be late. So just try to be understanding of that.
Right.
And so showing up prepared really does help your visit stay focused and helps your provider use the time well. But even when you do everything right, sometimes you do still end up waiting.
Right. So let's talk about how to reduce your waiting time without becoming that patient. Some little tips and tricks is to try and book that first appointment of the day if you can,
Hmm.
or the first appointment after lunch. So most clinics have a lunch break. I think ours was from like
Yeah.
12 to 2.
Hmm.
So if you could get that 2 o'clock or that 1:45 or that 2 o'clock, the chances of those nurses or the doctors falling behind have not happened yet.
Right.
If you're on a tight schedule, avoid late afternoon slots because delays happen over time throughout the day. So it's all those emergency add-ins that we talked about.
Hmm.
And that is when it starts to pile up later in the day. Also, people are getting off work and realizing themselves or their child need to be seen because they've developed a high fever over
Exactly.
the day
Yep.
or something's happened. So
Mhm.
try to avoid those at late afternoon slots if you can.
Yeah, because by 3:30 p.m., one sick kid, one mental health conversation, one emergency add-on, it can really add up and push the whole day back.
Hmm.
Also, late afternoon slots are great for convenience, especially if you're a working professional, but they're the most likely to run behind. So if you have to pick your child up by 4:30 or you have somewhere to be by 5, a 3:45 appointment may not be your
Yes.
safest bet.
Mm-mm. Right. Yes. And again, like Lauren mentioned earlier, use that online check in or the
Mhm.
portal check in if you can, because it reduces the front office bottlenecks. It updates insurance information beforehand. It lets staff prepare the chart early.
Mhm.
It prevents any kind of delays. And when you walk in, if you've done that part online, you walk in, you give your name. It's as simple as they look, you've provided your information already. They hit check in and it notifies that nurse and that doctor that you're there right then and there.
Yeah, and if five people arrive all at once and there's only one receptionist working, the person who already checked in online is the person that often gets to the room faster.
Mhm. Right. And to go back to what you said earlier, it is okay to politely ask, "Hey, I'm just checking if we're still on track to be seen today,
Mhm.
or should we reschedule?" Because sometimes check-ins can fail in the actual system. It has nothing to do with like the secretary or the nurse or the doctor. We are in the days of using computers and they don't
Yes.
always technology is great till it's not. So it's okay to do that if you're being polite about it.
Yeah, because sometimes your chart hasn't been moved forward in the system, and a
Mhm.
gentle check in kind of brings it back to the attention of the receptionist or the nurses, preparing for the appointment in the
Mhm.
the back.
Right.
So sometimes the biggest way to avoid waiting isn't about timing at all. It's about going to the right place in the first place. So,
Mhm.
next, we're going to talk about how to know whether you should call your doctor, head to an urgent care, or go straight to the ER.
Mhm.
And just wanted to note that we're not here to diagnose you, but we can give you a simple decision framework to help you decide where you need to go. So the first is going to your primary doctor or physician. You would go here if you're having ongoing symptoms that are mild to moderate in severity. Some things like this would include ear pain, rashes without breathing issues, persistent cough without distress, mild fevers in older kids, or any medication questions. Essentially, it's for issues that don't feel right, so you feel a little off, but it's not really an emergency. And an example of this would be a child that has a cough for about a week, but isn't experiencing any breathing trouble, is still playing and is still eating, but it's just not going away. Or, say you have mild back pain for a few weeks, it's getting annoying, but it's not getting any worse. These are all situations for your primary care doctor. They're not urgent, but they're still worth evaluating. The next is urgent care. You would want to go to the urgent care for something that needs same day attention or same day care, but is not necessarily life threatening. And examples of these would include possible strep, urinary tract infection symptoms, minor injuries like sprains, cuts, a mild asthma flare up that is responding to an inhaler, or even ear infections if you can't get into your primary care physician. So essentially, you're stable and you're doing okay, but you do need attention today.
Right. And another thing with urgent cares is you can actually go online and find out if they have a lab and radiology.
Mm,
There are some urgent cares that are attached to buildings that have a radiology clinic. So I don't know if that would help you make your decision, but you can look online for those. And if there is something in that urgent care and they feel that you need to be seen in the ER, they'll just send you to the ER.
yeah, a prime example of that. My daughter gets allergy induced asthma, which usually turns into pneumonia every year. It never fails around the February, March timeline because of the great pollen explosion here in
Mm-hmm.
North Carolina. But we would initially go to the pediatrician's office to have her seen, but then would always end up going to the ER for a chest x ray. So it's actually more beneficial for us to go to an urgent care associated with the hospital. And
Mm-hmm.
that way they can check her out. They have her past medical history and they can do the chest x ray on site so that we're not going to one doctor's office and then having to go sit in the ER and wait in the
Right.
ER for a couple more hours.
Right.
And then that brings us to ER, emergency room. You would go here for anything emergent, like breathing difficulty, chest pain, severe dehydration, uncontrolled bleeding, altered mental status, any seizures, a severe allergic reaction, or high risk fevers in infants. Of course, you want to call 911 for anything that is life threatening, but anything that's severe, you would go to the ER. So you'd go to the ER for things like your child struggling to breathe, or someone has chest pain that feels new or severe with shortness of breath, and they're feeling like they're going to pass out, or a baby that hasn't had a wet diaper all day and is starting to become very lethargic. Those are all situations where weeding could be dangerous, and it warrants an ER visit as soon as possible.
Right.
And then, just to be clear, in many of these situations, it may turn out to be absolutely nothing serious, but symptoms are your body's way of asking for attention, and they still deserve to be evaluated. I know in my personal experience, not that long ago, I had a day where I was working at home from my computer and I suddenly had the worst headache of my entire life. It was very sudden onset, behind my eyes. My blood pressure went up pretty drastically, and I felt very dizzy and had tunnel vision. Now, I have a history of migraines, and I could have stayed home chalking up all my symptoms to the migraine, but I decided to go ahead and go to the emergency room just to get checked out and make sure it wasn't anything more serious like a stroke or a heart attack.
Right. And don't let yourself or anyone else talk you out of going to the emergency
Yeah.
room. If
Mhm.
your gut says something is wrong and I need to be seen, just go. It's better to be safe than sorry. I don't know how many people I've seen where they just hold off and hold off and hold off. And next thing you know,
Yeah.
now instead of just an ER visit, they're now in the hospital for 5 to 7 days.
Yeah,
So,
or it could be too late,
right,
So don't
right,
take anything lightly. If your gut says go to the emergency room, go. Just go and
right.
get checked out. Nobody's going to judge you. If you're totally fine, it's better to err on the side of caution.
Yeah, better
Mhm.
safe than sorry. So,
Yes.
all right, now that we've talked about where to go, let's talk about the resources that are designed to help guide you. So, these resources will help, like, you're just not sure what to do and you need some guidance. Here are some phone numbers or websites you can check out. We will list these and we'll
Mhm.
also put them in the description of our episode. So if you miss this, don't be driving in your car thinking, wait, I need a pen. Like, we'll list it out. You can come back to it later. So the first one is your pediatrician's or your primary care nurse line. So most of these offices have a number that you can call during the day or an after hours number. Another one is that I was not aware of, and so it is the insurance nurse advice line. So and many people don't realize
Yeah.
this. I don't know
I'm
you
one of
if
them.
so on your insurance card or even your insurance website, they actually have a nurse advice line that is available 24/7 for most plans. Another one for those who have children, American Academy of Pediatrics. So that's healthychildren.org. So this is
Mhm.
one of the few websites that pediatric providers actually recommend.
Yeah, this is actually a great resource for pediatrics.
Another is the Center for Disease Control and Prevention, so the CDC. So if you need any vaccine guidance, any public health updates, or if you're traveling soon and you need to know what vaccines you need for whichever country you're going to, the CDC is a great place for that.
Mhm.
This next one is big, and I have given it out to many parents, and that is poison control. And I'm going to give the number. Again, we're going to put it on our video, and that is 1-800-222-1222. So, poison control. And poison control can be for many different things. It's for medications, chemicals around the house, cleaning chemicals, vitamins, or even supplements. So, anything that you're concerned about and you might just think it's minor, just call that number and they'll tell you.
So, one example of a situation where you may want to call poison control or may warrant a poison control call, I can't tell you how many times patients showed up in the doctor's office after their child had taken like 20 of those gummy vitamins. We
Mhm.
saw an increase in this once the vitamins were made to look like candies. Other instances are with melatonin gummies. So
Mhm.
even though these are vitamins or supplements, they are still considered poison if taken in excess.
Yes, that's a good point. Patient portals, this is a big one that I really like. I'm a big fan of lately is they now offer messaging. So instead of calling, there's a lot of people, especially like our parents' generation, that don't want to call and bother these doctors.
Mhm.
And so they can now just hop on this portal and message their provider, and within 24 hours, they get a response back. So the other option is telehealth. So for minor infections like the flu or COVID, and you test at home and you just need medication, if you have medication questions or follow-up questions, telehealth is a good way to go.
Yeah, I can tell you this was very useful for my family this past Thanksgiving. As luck would have it, we all came down with the flu on Thanksgiving Day.
Mm,
And of course, that's when you get sick on a major holiday when everything is shut and
everything's.
closed
Mhm.
down. And so the pediatrician's office was closed down, the urgent care was booked solid, and we all have the flu. We went to the local pharmacy, got flu tests, we all tested positive, and the last thing I wanted to do is sit in an ER for
Mm,
several hours just to get
mm-mm.
Tamiflu. So we were able to locate a telehealth platform and spoke to a physician and were able to be prescribed Tamiflu within the comforts of our own home while each of us were getting better from the flu.
So the next one, which is a big one, is the
Mhm.
mental health crisis line, and that is 9888. So all you have to do is call or text 988 for any mental health crisis, whether it's for you or a friend. Just call or text that number and they will get you the help that you or your friend need.
We know healthcare can feel very frustrating for patients and for the people working inside it. But the more you understand how the system works, the more you can advocate for yourself, show up prepared, and make the whole experience a little smoother.
Thanks for hanging out with us from the bottom of the scrub bin. If this episode helped you, share it with a friend who always shows up 3 minutes late or that friend who's always complaining about how long they wait at the doctor's. We love you, but we're just trying to help. We'll see you next time.
Bye.
Thanks for digging into the scrub bin with us. If you enjoyed today's episode, hit follow so you never miss what's next. And as always, stay real, stay kind, and stay curious. We'll see you the next time. Bottom of the Scrub Bin is a podcast produced under SafeQ Solutions, LLC. The views shared reflect our personal experiences and perspectives and are not intended as medical, legal, or professional advice, nor do they represent the views of any client or partner.